Welcome back to our channel. My name is Sogol Dargahifar and I am an associate marriage and family therapist at Embracing You Therapy. Today we are diving into a topic that affects many individuals: delayed sleep phase disorder, or DSPD, and its connection to Attention Deficit Hyperactivity Disorder, or ADHD. Let's unpack what DSPD is and how it relates to ADHD. DSPD is a circadian rhythm disorder characterized by a persistent inability to fall asleep at a socially acceptable or conventional time. Basically, the circadian rhythm is a 24-hour cycle run by our biological clock and regulates vital functions such as temperature, appetite, digestion, hormone release, and sleep-wake patterns. So individuals with DSPD often stay wide awake until the early hours of the morning, which can make it hard for them to stick to regular schedules and duties. Although they can sleep normally once they do fall asleep, it's tough to maintain a routine when they are up late. Now, how is DSPD linked to ADHD? Both conditions involve a disruption of the sleep-wake cycle and share similar symptoms such as impulsivity, difficulty concentrating, and erratic sleep patterns. While researchers are still exploring the exact nature of this relationship, recognizing the overlap between DSPD and ADHD can guide more targeted interventions and support for those affected. Alright, let's talk solutions. Here are 3 ways to overcome delayed sleep phase disorder. Number 1, establishing a consistent sleep schedule. This means aiming to go to bed and wake up at the same time every day, even on weekends. I know, easier said than done, especially when you are struggling to fall asleep on time. But here's the trick. Start by changing when you wake up, not when you aim to fall asleep. By getting up at the same time every day, regardless of how late you went to bed, you are essentially resetting your body's internal clock. It may take some time and consistency, but gradually you will work your way towards a sleep pattern that better aligns with your daily life. A consistent sleep schedule also means that however early you have to wake up is your time to wake up. Even if there is only one day of the week where you have to be up at that time, it is beneficial to wake up at that time every single day. So if it means sacrificing a little extra sleep, sticking to your wake-up time will pay off in the long run by improving how you feel and function throughout the day. Number 2, let's talk about sleep hygiene practices. Basically, it is a strategy aimed at training your body's internal clock to adapt to a desired sleep schedule. Even if your body naturally wants to sleep at a different time within the 24-hour cycle, you are essentially setting up conditions to encourage an earlier bedtime. So, sleep hygiene involves recognizing potential obstacles to good sleep and modifying behaviors and routines to minimize or remove factors that are challenging for you. Whether it's excessive screen time, late night meals, or a lack of relaxation before bed, pinpointing these stumbling blocks is the first step towards improvement. Also, your nightly routine isn't all about getting ready to bed. Choices you make earlier in the day, like how much caffeine you have and when you have it, can affect how easily your body can unwind later on. Even substances such as alcohol, which have a calming effect on the nervous system, can interfere with the sleep patterns. So try including relaxing activities into your evening routine, like reading a book, practicing meditation, or even enjoying a warm cup of tea. By gradually transitioning away from screens and artificial light, you will signal to your body that it's time to unwind and prepare for sleep. Lastly, don't hesitate to seek professional support if you are struggling to manage your DSPD on your own. A healthcare provider or sleep specialist can offer personalized advice and suggest treatments tailored to your specific situation. While some people who experience insomnia symptoms may later receive a diagnosis of DSPD, but this doesn't mean that traditional insomnia treatments aren't effective for DSPD. Also, cognitive behavioral therapy for insomnia, CBTI, targets the thoughts and feelings contributing to insomnia and teaches the strategies to adjust sleep behaviors. Seeking professional support can also involve treatments like bright light therapy, which is slowly adjust your sleep schedule to a more desired pattern. In some cases, medication can help too. Remember, there are different ways to try, but you need to find what works best for you. Working with a knowledgeable professional can empower you to effectively manage your DSPD and reclaim restful sleep. Remember, managing DSPD takes time and patience. Celebrate the small victories along the way and don't be afraid to ask for help when needed. And that's a wrap for today. Thank you for tuning in, and remember, a good night's sleep is essential for a happier, healthier you. Until next time, sleep well and take care.